If you have PCOS, you've probably heard the term insulin resistance come up a lot. But what does it actually mean for your body, your hormones, and your health? Today, I'm going to walk you through the top 5 things you need to know about insulin resistance and polycystic ovary syndrome. My name is Dr. Bess Maffaris. I'm a board-certified OBGYN, and I have 2 degrees in nutrition. I specialize in the care of patients with PCOS or PMOS, as it has recently been renamed. Let's start with number 1. Insulin resistance is one of the main drivers behind PCOS or PMOS. PCOS is the most common hormonal disorder in women of reproductive age, affecting roughly 1 in 8 women. And while most people think of it as a problem with the ovaries, the truth is that insulin resistance sits right at the center of the condition for the majority of women who have it. Somewhere between 50 and 80% of women with PCOS or PMOS have some degree of insulin resistance. So what is insulin resistance? Normally, when you eat, your body releases insulin to help move sugar from your blood into your cells for energy. With insulin resistance, your cells don't respond to insulin as well as they should. Your body compensates by producing even more and more insulin. That extra insulin floating around in your bloodstream is what creates a cascade of problems, and that brings us to number 2. Number 2 is that high insulin levels fuel excess androgen production. This is the connection that surprises a lot of people. When insulin levels are chronically elevated, it directly stimulates the ovaries to produce more androgens, which are sometimes called male hormones, like testosterone. At the same time, high insulin suppresses a protein made by the liver called sex hormone binding globulin, or SHBG. HBG normally binds to testosterone and keeps it inactive. So when the SHBG drops, more free testosterone circulates in your blood. This is why many people with PCOS or PMOS experience symptoms like acne or excess facial or body hair or thinning hair on the scalp and irregular periods. The elevated androgens also interfere with normal follicle development in the ovaries, which disrupts ovulation. So in many cases, addressing insulin resistance can actually help bring those androgen levels down and improve those symptoms. Number 3, you don't have to be overweight to have insulin resistance with PCOS or PMOS. This is one of the biggest misconceptions out there. Many people assume that insulin resistance only happens if you carry extra weight. That's simply not true. Research shows that lean women with PCOS or PMOS can have significant insulin resistance compared to women of the same weight without PCOS. About 20% of women with PCOS, PMOS are not overweight at all, yet they can still have the same underlying metabolic issues. In fact, recent studies have found that even normal weight adolescents with PCOS or PMOS show higher insulin resistance and markers of metabolic dysfunction compared to their peers. So regardless of what the scale says, if you have PCOS, it's worth having a conversation with your doctor about your metabolic health. Number 4, insulin resistance increases your long-term health risks. PCOS or PMOS is not just a reproductive condition. The insulin resistance that comes with it raises the risk of several serious health issues over time. Studies show that up to 40% of women with PCOS may develop impaired glucose tolerance or even type 2 diabetes by age 40. Women with PCOS also have higher rates of abnormal cholesterol levels, high blood pressure, and cardiovascular disease. The metabolic effects tend to build gradually. Insulin resistance promotes higher triglycerides, higher LDL cholesterol, and lower HDL cholesterol, which together create what doctors call and atherogenic lipid profile. That's a pattern that increases the risk of heart disease. This is why international guidelines now recommend that all women with PCOS be screened for metabolic risk factors, including glucose tolerance, regardless of their weight. And finally, number 5, lifestyle changes are the foundation of treatment in insulin resistance, and they genuinely do work. The most current international evidence-based guidelines recommend lifestyle intervention as a core part of PCOS or PMOS management for every woman with this condition. That means regular physical activity and a balanced, healthy diet, good sleep. The good news is that no single extreme diet is required. A range of balanced dietary approaches can be effective, and even modest changes make a real difference. For exercise, the general recommendation is at least 150 minutes per week of moderate intensity activity or 75 minutes of vigorous activity. Strength training on 2 days per week is also encouraged. Research shows that even a 5 to 10% reduction in body weight, when applicable, can significantly improve insulin sensitivity, restore ovulation, lower androgen levels, and reduce cardiovascular risk factors. Beyond lifestyle, medications like metformin are commonly used to help improve insulin sensitivity, particularly in a woman with a BMI of 25 or above. Newer medications are also being explored, but the foundation always starts with how you eat, how you move, and how you take care of yourself day to day. Insulin resistance is central to PCOS or PMOS for most women. It drives excess androgen production and many of the symptoms you experience. It can happen even if you're at a normal weight. It raises your long-term risk for diabetes and heart disease. And the most powerful first step you can take is a healthy, active lifestyle. Every person's situation is different, so please talk with your healthcare provider about what's right for you. If you found this helpful, please leave a comment, share it with someone who might benefit. Remember to subscribe so you don't miss future videos. Thanks for watching.